So would you mind introducing yourself?
Sure, I'm Peggy Polaneczky. I'm a gynecologist and a blogger.
And what do you blog about?
I blog about food, women's health, my life, and the intersection of life and women's health.
So I'm really interested in your food blogging. We just had lunch, and I'm interested to hear your opinion of the lunch at MedX.
I have to say, best food at any conference I've ever been to.
So by best, you mean tastiest, healthiest?
Combination of both. Gluten-free for the people who need it, lots of salads for people who are dieting, lots of protein at breakfast, which was really great for the people that are trying to go low carb.
I agree. It was delicious as well.
Fresh, delicious, wonderful fruit.
So can you talk to me a little bit about the connection between health and food? It's something that you hear about maybe in magazines, but I don't know that it's often discussed with medical professionals.
Yeah, what we eat and drink affects how we feel in so many ways. I'm going to give you one small example. I take care of a lot of menopausal women with hot flashes, and I can't tell you how many of them are having a glass of red wine with dinner every night. And one of the biggest triggers for a hot flash is a glass of red wine. And when I tell women that, this light bulb goes off, and I say, before you take any hormones, before you do anything, stop the wine, and that might be all you need to do to get rid of your hot flashes.
Do you think that other gynecologists even know to ask that question about the wine?
I hope so.
So what do you think is a good way to get other physicians engaging with their patients about issues of nutrition and food?
That's a tough one. I think education about nutrition in medical school is paramount. I don't know, are you getting education at Stanford?
We get a little bit of education about nutrition, but I don't think it's comprehensive.
Yeah, I think that's really important. And then I think having a nutritionist to refer patients to is really important, because I don't have time in my office hours to give people advice. So clearly having someone they can talk to is helpful.
Have you learned anything at the conference, any interesting or exciting platforms to be able to disseminate this knowledge more widely? Because as you said, a lot of professionals simply don't have the time to sit down with each patient.
Exactly. I mean, I think what I'm learning here is that the patient has to drive the education and the choices and the decisions that they make, and that the more tools we give patients, the more empowered they'll be. So the place to do it is out in the public domain of the internet and not necessarily in my office.
That's really great. Thank you so much for speaking with me.
You're welcome. It's a pleasure.
This is Hayley with The Buzz.